Welcome to the NICU Today Podcast, a podcast to give families a new point of support as they navigate the NICU journey. Thank you for listening. Please don't forget to subscribe wherever you enjoy your podcast and share this episode with anyone who might find it helpful. Welcome to the NICU Today Podcast. We are very excited to have our guest with us today. Chelsea Petrosky is a certified trauma therapist serving survivors of trauma over the last 13 years in various clinical and victim services settings. Chelsea has worked as the director of counseling and clinical services at a local domestic violence organization and is the founder of Chelsea Petrosky Therapy, LLC, which provides EMDR therapy and trauma healing services to survivors of complex trauma, intimate partner abuse, maternal, pregnancy, and birth trauma, and traumatic grief locally in Bucks County and virtually across Pennsylvania. She is a mother of two boys who personally experienced the NICU journey with her youngest son, Nathaniel, who is now 2 years old. Chelsea is eager to support survivors of pregnancy and birth-related trauma through EMDR therapy. Welcome to the NICU Today Podcast, Chelsea.
Thank you so much, Martha. I appreciate you having me.
Well, I have to tell you, I'm really very interested in this EMDR therapy and trauma healing services that you offer to clients that you work with. But we also know that you are connected to the mission of Today is a Good Day because you are a NICU mom. So we're hoping that you can tell us a little bit about your family's NICU journey.
Yeah, absolutely. I'm happy to share. And I love that this connection to you has allowed me to share both some of my professional experiences and my personal experiences. So starting there, I have two boys. I have a 2-year-old Nathaniel and a 9-year-old named Lucas. And 2 years ago, when we went into our birth experience with Nathaniel, I had anticipated a smooth sailing experience because I had had a pretty typical pregnancy, no real complications or challenges throughout my pregnancy. So we also went in for a planned C-section because I had had a C-section with my first son. So everything was, moving according to plan. But shortly after Nathaniel, and we call him Nathan, so I'll refer to him as Nathan. Shortly after Nathan was born, we were told that he had swallowed a lot of fluid, during the birth experience, and that he was having a lot of trouble breathing. And, after a bit of time, we had discovered that he had experienced what's called a pneumothorax, which is like a hole or a pocket in the lung that can develop where air can be released outside of the lung within the chest cavity. It can lead to lung collapse, really serious health concerns. So obviously, that was a very scary experience. He was moved into the NICU at St. Mary's Hospital, which is the hospital here in Bucks where I had given birth. We spent about 48 hours there, and then we were moved to CHOP for additional care in the NICU there. Another thing that was really scary at the time was that I was told with his transport from St. Mary's to CHOP that he would be placed on a ventilator. And this was in 2022, right in the middle of COVID. And I'm sure for many people, hearing the word ventilator during COVID was a very terrifying experience for sure. So, just in the whirlwind of all of it, it was very scary, very stressful. He did made the transport safely down to CHOP. And shortly after getting to CHOP, his health did improve. The hole in his lung did heal naturally over time. He didn't need any surgery, and he was able to progress with then breathing on his own, went from having a feeding tube to then feeding on his own, all of those things. So luckily we had about a 9-day stay total, which I know is a short period of time compared to many families who experience the NICU. But I think most people would agree that even one day in the NICU is a very stressful and scary experience for any families and parents going through it. So luckily, we were able to come home about 9 days later, actually on Mother's Day.
Oh,
We were able
wonderful.
to bring him home, and he's had a very healthy and typical experience in his development since. So luckily there were no, challenges that lasted after that experience. Everything has been on track for him since, but obviously it was a really life-changing experience and has led me to just have more empathy, of course, for other parents who are going through it. And that's why I've been eager to offer more support in this area
Yes.
in my practice.
Well, I want to ask you, so you delivered him full term
Hmm.
and an unexpected stay in the NICU. And we talk about it a lot. I'm mom to 23 weekers. I
Yeah,
knew I was going into the NICU when they arrived early.
right.
How did it feel going in as a full term pregnancy, going in for scheduled C-section, and then to end up in that situation? Talk to us about those feelings.
Hmm. I mean, it was very confusing and really a whirlwind. Like, so much information is coming at you at a time where you're overwhelmed. It's shocking to hear that anything is happening to your baby that you didn't expect or anticipate. Um, we also live in New Hope, PA, which is about like an hour to an hour and a half away from the city. So having to transition to care at CHOP with a 7-year-old at home, we had to create, additional plans for um, care for our older son, which was unexpected. So, we had to enlist more family support there. That was stressful and difficult. He had also been an only child for 7 years. So the idea of even adjusting to a new baby at home, having him understand why we were going back and forth to the hospital, all of those things, it was just so unexpected. And at the time, very stressful, overwhelming, and scary, just because we didn't
Mhm.
know what would happen. And especially in the beginning, it was such a fragile time for him. And it was also really hard to bond with him in the way that I had anticipated, because obviously he was taken um, into the NICU right away after his birth. So I wasn't really able to hold him and nurture him in the way that I had hoped to. It was so different from my experience with my first son's birth. So all of it was just very, very overwhelming and unexpected, and a very emotional time for my husband and I going through all of it.
So, as a full term parent going into the NICU unexpectedly, and I totally agree with you. We say all the time, it doesn't matter how many days you're in the NICU. It's not where you want to be. It's not where you expect to be. And it's traumatic. But any advice you have for other parents that are maybe those full term parents that are being put into the NICU or admitted into the NICU?
Sure. Yeah, I mean, I think the first thing that I would say is just, allow yourself to feel whatever it is that you're feeling. If you're feeling overwhelmed or scared, if you're feeling confused, if you're feeling a lot of stress and anxiety, if you're feeling sort of torn in between two places, if you have children at home and children in the NICU, just giving yourself permission to feel and process whatever it is that you're feeling through that experience. I would also encourage parents to lean on friends and family, lean on the supports in the NICU setting, like the social workers, the doctors and nurses who are there to help support you through the process. Definitely ask a lot of questions, make sure that you feel like you can advocate for yourself and your family, and that you have the information you need to be able to cope with the experience. Also, there are additional resources that can be put in place for families who are going through this. So if you're needing to connect to any resources or supports, or if there are things that you're needing to help get you through the experience, just asking for the things that you need, and, advocating for yourself and your family is always helpful. And just really taking good care of yourself. Obviously, when you have a new baby, it's always a time where you're sleep deprived, you're feeling overstretched often, but just trying to make sure that you're getting good rest, that you're eating well, that you're drinking enough water, that you're limiting your physical activity and walking, because your body is still recovering from your birth experience, especially if you've had a C-section. I remember trying to walk a really far distance from the parking lot up into the NICU, and how hard it was on my body, even just trying to make the travel. So yeah, just really practicing self-care and leaning on the people who are there to support you. I think those things are most important.
Wonderful. Thank you for sharing that with us. How is Nathan today?
He's great. He's thriving. He's doing well. He's so cute and sweet. And both of my boys have created a great bond with each other. They have 7 years apart, like I said, but they're best buds, and it's been really great. It's been great to see him, just growing up healthy. I was nervous after all of that, like going to his doctor's appointments, and I remember feeling a lot of anxiety in the beginning that maybe there would be long lasting effects or complications that he could experience later on. And I think that's one of the kind of impacts of that type of trauma, is that carries with you as your children are growing, and you can have continued anxiety and fear about their health. Even if they are healthy and safe, sometimes the trauma of going through a NICU experience can leave you with those fears. And of course, as a trauma therapist, that's something that I was able to recognize and I've been able to get my own support with. But I know that's an important thing for a lot of other moms and parents in general who are navigating this, that the trauma of the NICU experience can continue even long after, even if your child does come home healthy and safe. Sometimes that trauma can carry with you.
Yes, for sure. Now, you had this experience. Is that what really led you into the line of work that you're doing now? Or did you always want to become a therapist?
Yeah, well, so I've been a therapist for a long time before all of this occurred. I chose very on in my college experience that I wanted to be a therapist, and actually decided pretty early on that I wanted to do trauma work. I had interned with the Sexual Assault Services Center on my campus, just really, really early on in my educational career. I decided to pursue a master's in social work. In my clinical internship, I pursued an opportunity through the Bucks County Network of Victim Assistance, which is our victim services agency here in Bucks, where I worked with victims of trauma, particularly sexual assault and other crime here in Bucks County. So in my educational experience, I had a lot of exposure to trauma work. So after graduation, over these last 13 years since I graduated in my master's program, I've really dedicated myself to doing trauma work in my career. I started out in more general mental health settings, but often would work with trauma survivors within my caseload. And then I decided to take a position with A Woman's Place, which is our local Bucks County domestic violence agency, where I had worked for the last 7 years. I actually just ended my position there at the end of June and have transitioned full-time into my private practice. I did start my private practice back in January so that I could expand to working with survivors of trauma of all forms. I still do often work with survivors of domestic violence and sexual assault, but in my private practice, I am working with people with a variety of trauma-related concerns. And I do work with a lot of women in my practice who have reproductive trauma, things like infertility, pregnancy trauma, pregnancy losses, birth trauma, postpartum experiences that have been difficult. So that is an area that I'm expanding in my private practice work.
Wonderful. Why I'm sure you are supporting so many, and I am really interested in learning more specifically around EMDR therapy. Can you talk to us about what that stands for, what it means?
Sure, absolutely. So EMDR stands for Eye Movement Desensitization and Reprocessing Therapy. And it is a specific kind of trauma therapy that is evidence-based, which means that there's been a great deal of research that has shown the effectiveness of this type of therapy for survivors of trauma and those with PTSD symptoms. EMDR therapy is also a type of therapy that can be used for a variety of different mental health concerns. It can be used for any type of disturbing or distressing life events, grief and loss or traumatic grief. It can even be used for things like anxiety, panic attacks, depression, even chronic pain, sleep disturbance, and of course, violence and abuse, things like sexual assault, domestic violence experiences, or any forms of childhood trauma. So EMDR can really be utilized for anyone whose life has been impacted by trauma. And for many people, trauma can be complex. People may not have just one traumatic experience. Maybe they've had many layers of traumatic experiences throughout their lifetime. Many of the people that I work with will come to me maybe because of a more recent traumatic experience, but often when we explore their history, we realize that maybe there are more layers to their earlier trauma experiences that they've endured. Maybe they grew up with an abusive parent or in a neglectful household, or maybe they had a family member who experienced a mental illness or who was absent in their caregiving. So there are a lot of different layers of trauma that we can explore with EMDR. EMDR can be used to process more recent event traumas or single incident traumas, meaning like a one-time traumatic experience, or it can be used to explore layers of trauma, meaning looking at a number of different traumatic experiences throughout someone's life.
And would someone, if they were interested in learning more about this, I just think about different therapists that are out there. Not everyone practices this type of therapy. So
Right.
would you look up in your area, or I'm going to ask you to share more about where listeners can learn about your practice as well. But would you look up that type of therapy to see what providers are available?
Yeah, absolutely. So because EMDR is one specific type of therapy, there are a lot of different kinds of therapies out there. So different therapists have different backgrounds and training and areas of specialty. But EMDR therapy is a very common approach in the trauma therapy world because it is proven to be so effective. And so it is widely used in trauma specialized treatment. So the first thing I would say is that if someone has experienced a trauma and is seeking trauma therapy, it's really important to try to connect with a provider who is a trauma specialist, who has specific trauma-informed training. As an EMDR therapist, I have experienced both my EMDR basic training, and I am also certified as an EMDR therapist through EMDRIA, which is the EMDR International Association. So if you're looking for an EMDR provider, it's really helpful to look for someone who is certified through EMDRIA, which means that they've received formal training in EMDR and they've went through an extensive period of additional supervision, consultation, and advanced training to specialize in this modality.
I think it's so important. You bring up the idea of trauma, and trauma can look different to every person, like what you were saying. Trauma, sometimes I think with the NICU in particular, I don't know that everyone realizes that they've experienced trauma when they have a premature baby, or it's the expected start to parenthood. What are your thoughts in helping someone know that they might need to seek out therapy, or look into some different options that are out there?
Right. So I would say, trauma can really be any experience that sort of overwhelms our capacity to cope. So anytime that you're experiencing something in your life that's extremely overwhelming, it could be, something unexpected that has happened that has had a really difficult impact on your life. It also can be sometimes the absence of something that you've needed. So in examples like maybe children who've experienced early neglect, things like that, that trauma is sort of the absence of something. And other traumas can be something bad that happens to us, or something that happens to us that really just overwhelms our system.
Mhm.
It's also important to recognize when you've experienced something in the past, but you're still having a lot of thoughts or memories of that experience, or the memory of that experience is still having an impact on you in the present. For example, if someone is having nightmares or flashbacks, or a lot of, recurrent thoughts or images of the experience that they went through, or if they're having maybe heightened anxiety or more feelings of depression or sadness or loneliness, or if maybe if you're just feeling off, like your life just feels different now after that traumatic experience than it felt before. For anyone who's experiencing those things, trauma therapy can really help and can be such a gift. Trauma therapy can be very transformative for people and can also be often much more helpful than other forms of talk therapy because trauma really lives in our brains and bodies. So EMDR therapy is a mind-body healing approach that takes a different perspective on how to heal the trauma by really looking at reprocessing the traumatic memories in our brains. And so many clients that I've worked with have had other forms of talk therapy where they've shared about their experiences, but sometimes sharing about the experience isn't enough. Sometimes there needs to be other methods that we incorporate in therapy that really allows you to reprocess and sort of put away those memories into long-term memories so that they're stored properly. In EMDR, what we know is that traumatic memories are stored differently than our everyday memories. They almost are stored kind of in a stuck form where they still hold all of the emotional sensations and intense feelings and vivid pictures. That trauma memory is sort of, kind of in a way, imagine it sort of floating in our brains in a way where it's sort of lighting up all the time. Mm-hmm. So in EMDR therapy, we're reprocessing the memory so that we can put it away and then it doesn't have the same impact on us in the present.
Okay. That is really, really helpful. So I do want you to tell us what EMDR stands for one more time, and then tell us where listeners can learn more about your practice.
Sure. So EMDR therapy stands for eye movement, desensitization, and reprocessing therapy. And the best place to go to look for any information about EMDR therapy is the EMDRIA website. So EMDRIA.org is the website for the International Association for EMDR. There's a lot of great information and videos and all kinds of like easily digestible information that helps any lay person to understand what EMDR is all about, how it's effective, what the potential benefits are. And there's also a referral directory through EMDRIA where you can locate local providers who are certified in EMDR and providing this type of therapy in your local community. For myself, I am located in Buckingham, which is outside of the Doylestown area in Bucks County. I have an office space here where I meet with clients in person, and I can also provide therapy virtually via telehealth to anyone across the state of Pennsylvania because I am a licensed clinical social worker in PA. So I can work with anyone virtually across the state of PA, and people who are local to Bucks County can find me via my website. That's really the best way to find my contact information. My website info is www.chelseapetroskytherapy.com. And I also have a listing on Psychology Today, which is another profile listing service that's very helpful for people who are looking for therapists. When you go on Psychology Today, you can search by your zip code, by your insurance type, by the type of therapy that you're looking for. So that's another really helpful resource for people looking for therapists. But yeah, all of my info can be found either through Psychology Today or directly through my website. I do offer a 15-minute phone call with anyone who's looking for information about my practice and to just discuss, what someone might be looking for in terms of therapy support and what their goals are, and to explore my experience and my background and to make sure that I might be the best fit for them. And then if people are looking to proceed, we can schedule from there. So yeah, that's the best way to find my information if people are looking to connect with me. And just for your audience, what I would say is, again, if there are any parents who have experienced any kind of reproductive related trauma, infertility, pregnancy losses, traumatic experiences during pregnancy due to complications, traumatic birth experiences, any difficulties in postpartum, I'm happy to help. I'm happy to work with anyone who's experienced those things. I'm also happy to work with fathers who are experiencing the trauma of the NICU as well, or who are also experiencing the trauma of their stressful experiences or grief and loss experiences that they've endured with their children as well. So I work with people, of any gender, any background. And like I shared, I do have experience as well in domestic violence, sexual assault, childhood trauma. So if anyone is navigating those additional layers of trauma, I do have expertise in that arena as well.
Thank you so much. All right. I only have one more question for you, Chelsea.
Sure.
I always like to end on this. Anything else that we didn't cover today? Anything you want to share with the listeners?
I think I would just say, that therapy can be such an important space for healing. And it really is a gift to have the time and space to take good care of yourself through this realm. And finding a therapist who you can build a really strong relationship with can be such an important part of people's healing journeys. So for anyone who's feeling maybe unsure or nervous about reaching out to a therapist, I would just encourage you to remember that life can be so different when we've healed from the traumas that we've endured. And so it really can be, such a valuable gift to give yourself or your family to do this kind of work. And I'm just really honored to do this work with people. I really love the work that I do with my clients, and I'm happy to answer any questions that anyone might have if they're wanting more information about the things we've discussed today.
Well, thank you so much for being a guest on the NICU Today podcast. We're thrilled to talk with you today. All of the information will be available in the notes for this episode on the NICU Today website, and we appreciate you being here, Chelsea. Thank you.
Thank you. Thank you so much for having me, Martha. It was good to see you.
You too. Thank you for tuning in to the NICU Today podcast, brought to you by Today is a Good Day. Learn more at todayisagoodday.org.